Is back pain one of your IBS symptoms? Stay tuned to find out how you can reduce this and what you can do to help when it's happening. If you're new here, welcome. I'm Amanda Malacheski, functional nutrition coach and digestive and allergy detective. For tips and tricks on how to manage your digestive and allergy challenges naturally, be sure to subscribe and hit the bell to be notified when I release a new video every Monday. Last week, a viewer asked me to talk about IBS and back pain and to talk about what you can do to help your IBS back pain feel better. So today I'm going to share my personal and practitioner tips for dealing with IBS-related back pain and let you know what you can do also to help yourself when a flare is underway. I used to have a lot of back pain flares with my IBS symptoms, but using these methods and techniques, I have virtually eliminated them. So let's get started helping you figure out how to do this too. So low back pain is definitely a common symptom of IBS because if you think about it, it makes sense geographically. Your intestines are located close to your low back especially. So if your gut is feeling inflamed, the nerves and the tissues in that area can send signals for pain back to the brain. No fun, right? So as a practitioner, I like to think about this, especially from the perspective of what is triggering these attacks and start there. So I'll bet you can come up with a short list of things that trigger your IBS symptoms, and it's always good to kind of keep a running list so that you can keep referring back to this. One of the first and obvious places to start looking at this is looking at your food. And I talk a lot more about this in my earlier video called How to Identify Your IBS Food Triggers. But the basic gist is that you want to do a proper elimination diet to remove suspected food triggers and then use a food symptom tracking tool to assess your work. Definitely check out that earlier video for the lowdown on that. But today I want to share a couple of lesser known possible food triggers that you may not be aware of to help you out. IBS back pain trigger number one is foods high in oxalic acid, otherwise known as oxalates. Some people have a difficult time metabolizing the naturally occurring oxalic acid in certain foods, such as spinach, chard, beets, sweet potatoes, peanuts, coffee, tea, chocolate. These are some of the common ones. For a complete list, you can download my Oxalates Handout. I will leave a link for that below for you. Oxalates form jagged little crystals in your tissues and throughout the body. They can happen anywhere in the body, and it's actually the material that kidney stones are made of. And if you have trouble metabolizing oxalates, these crystals can build up in any body tissue or organ and create pain. So go ahead and check out the oxalate food list and see if any of these food items might be a pretty big part of your diet. They may be something to consider looking into reducing. But I will give you this caveat. Do not attempt to suddenly do an oxalate-free diet because this usually will make your symptoms far worse. So if you'd like to get some instruction about how to do this safely and properly, please watch my earlier video, Oxalates and Digestive Symptoms, for a much more thorough discussion of how to do this safely. IBS back pain trigger number two is grains. A lot of people get generalized joint pain from consuming grains, and there are a lot of reasons why grains can trigger this kind of pain and inflammation. But a simple way to evaluate this is to do a trial elimination diet and see how you feel. It's imperative, though, to be using the food symptom diary to do this process because sometimes the reactions can occur several days after consumption. So be sure and check out my earlier video, How to Do an Elimination Diet for IBS, for more information about that. IBS back pain trigger number three is nightshade foods. Nightshades are a group of food in the Solanaceae family. So these include tomatoes, potatoes, eggplants, peppers, tomatillos, okra, and a lot of spices like chili powder, for example, which is made from peppers. So there's a very well-established correlation for some people between joint pain and nightshade consumption. So in your elimination diet work, this is another area to consider. And I should jump in and say here that it's important to not grab these lists and start eliminating everything on them. The way I want you to use these lists, and I talk about this in my other videos as well, is to look at those lists and see which foods are the most commonly consumed for you and start there. Don't eliminate everything. So be mindful, be careful, go slow. IBS back pain trigger number four is hidden underlying infections. And I'm sure for many of you, you are aware that your IBS may be related to some infection or another. But here I'm talking about things like bacteria, parasites, yeasts, and also viruses. If you think about the herpes virus family, these viruses reside in the nerves, in the spinal nerves and in nerve tissue. And then when they flare up those nerves and they cause a lot of pain. I've long had this theory that there's an association between herpes viruses and back pain flares and IBS altogether. So if you suspect that infections may be an issue for you and you haven't worked on this at all, I encourage you to work with a functional medicine or naturopathic physician to do some evaluation. But in the meantime, if you'd like a little bit more information about that, you can check out my earlier video called Gut Microbiome Testing for IBS. I talk about some of the tests that functional practitioners use in that video. And for viruses, you can request a test called Nightshades, which kind of looks at the metabolic exhaust for viruses. And if you have a positive result on this test, this may indicate that there's a little bit more investigation needed for you around viruses. So now that we've covered some of the possible food triggers that can be involved or infectious triggers that can be involved with back pain for IBS, let's talk about what to do when you're actually having a back pain flare. So the very first thing that I do when I have one of these episodes is I increase my daily dose of magnesium by double. And I use magnesium in the form of magnesium glycinate. And this is because I can increase that dose without triggering diarrhea that might happen with magnesium citrate or another form. The next thing that I increase or add in are antioxidant nutrients. So these are things like vitamin A, vitamin C, vitamin E, alpha lipoic acid, glutathione or N-acetylcysteine, and also B vitamins. All of these things help your body manage the inflammatory damage that's happening with the flare and help your body clean it out faster. The next thing I use are binders like activated charcoal or clay. And this is especially if the triggering event has to do with a food that my body didn't like. So this can bind up inflammation and toxins in the gut so that they can be eliminated. And coupled with that, I use daily plain water enemas just to help keep moving things through the intestines during that time. The last thing I want to talk about that I use to help manage my back pain flares is physical activity that's targeted for the specific purpose. When I used to have a lot of flares, I had an appointment with a friend of mine who's a Pilates instructor, and she helped me work through some exercises that would help rebalance my muscles from left to right, because when my back flares, one side of my hips elevate. There's a little bit of a twist in the pelvis, and some of the muscles on one side of my back get really tight and the other side just sort of loosen and they can't work properly. So she had me do these exercises which helped rebalance those muscle actions on both sides of my body. So certainly used properly, both Pilates and maybe yoga or other kinds of physical activity could help rebalance those muscles and get them functioning well again. So I encourage you to reach out to somebody that can help you with that. So I'd like to hear from you about ways that you have managed your IBS-related back pain. Is there something I didn't mention here today that's really helped you? Please share it so other people and other viewers can benefit from it. So I hope that now you have a few more tools in your tool belt to work through your IBS-related back pain. So if you feel like this has just scratched the surface for you and you need a little bit of additional help, I've created a systemic approach to how to manage digestive and allergy challenges in a holistic way. And it's called the Roadmap to Gut Recovery. And you can grab your free copy at confluencenutrition.com/roadmap. So go ahead and head over there and grab your free copy. Or if you're ready for some pro-level support in figuring out what your specific food triggers are, because I know this can be really complicated and confusing, I encourage you to please schedule a free 30-minute assessment session with me at confluencenutrition.com/contact. During this session, we will talk about how I work and how I might be able to help you sort that out. Thank you so much for watching. If you liked this video, please let me know by liking it below and share it with your digestively challenged friends or family. And comment below with a question you'd like me to answer in a future video. See you next time.